We do recognize that these postponements are extremely stressful on patients and their families, and we're working very hard to reschedule them as soon as we can. However, these decisions do help us preserve capacity to care for the patients who are very sick and need care immediately, helps us avoid hospital overcrowding, and ensures we have enough team members on hand to provide safe and proper care for every patient. Despite all these efforts, patients and their families are currently experiencing significantly longer wait times in our emergency departments due to the sheer volume of people seeking care. If your child is sick or you think they may have RSV, we want to encourage families to call their child's doctor as early as possible to determine if they should receive care at home, be seen in the doctor's office or urgent care, or if they should go to the emergency department. Speaking personally as a father myself, who also happens to have sick kids at home right now, I know how incredibly stressful and tiring it is to have a sick child. But by knowing who to go to and when, you can be better prepared when the unexpected hits. Because if we all do our part, caregivers and community members can help protect Colorado kids and keep patient loads manageable at local hospital emergency rooms this season. To reiterate what Dr. Hurley said, we certainly support everybody taking as many preventative measures as possible to prevent the spread of these illnesses, including washing your hands, covering coughs and sneezes, wearing masks when you're symptomatic, and please not sending kids to school when they're sick or going to work yourself when you're sick. And of course, also with the upcoming holidays, it's important to be mindful of play dates, family gatherings, and holiday events, and to take precautions beforehand and stay home if you're sick. And again, like Dr. Hurley said, we urge everyone who can to get the COVID-19 vaccine and a flu shot, and to make sure all kids are up to date on their scheduled vaccinations. So in closing, local families in hospital emergency rooms continue to get hit very hard right now with RSV and COVID-19 and very soon influenza. And it's not showing signs of letting up. So it's important for all of us to be aware of this to help protect the most vulnerable members of our community, which include our children. I do want to mention that the families can still depend on us, and Children's Hospital Colorado is very grateful to CDPHE and the partners we're working closely with, including schools, partner hospitals, and policymakers for helping keep our kids safe. You can find additional resources on our website at childrenscolorado.org/RSV info. And I am happy to turn this over to Scott Bookman from CDPHE.
Thank you, Dr. Carney, and thank you all for joining us here today. I do want to take a moment to thank and acknowledge all of the healthcare providers who are on the front lines. It is yet another unprecedented impact on our healthcare system that we are seeing at this time. And the nurses, the respiratory therapists, the providers, our pre-hospital providers who are all working around the clock to provide the best care possible deserve our gratitude and our recognition. And so I'm going to give a little bit of an update today on where we are in our response, and want to start by looking at our flu doses administered year to date, comparing where we are today to previous years. And I think it's a mixed message. The good news is that we are on par with where we were in 2021, but we are not where we were in 2020. And so we do have an opportunity here to increase our influenza vaccination rates as we head into this flu season. Next slide, please. And so here is a graph showing the total pediatric ICU bed availability in the state of Colorado. This is an incredibly specialized resource, and there, at normal times, we see an average of about 22 of these pediatric ICU beds available. You can see over the last few weeks the dramatic decrease in the total bed capacity that we have had, and we have been hovering between 0 and 5 pediatric ICU beds available at any given moment over the last several weeks. Next slide. So at CDPHE, we are doing a number of things to ensure that we have a coordinated statewide response to what we are seeing with RSV, COVID, and what we are anticipating to see with influenza. So as they have throughout this pandemic, our hospitals across the state have come together in partnership to ensure that we are using every bed available to serve those in need. And in fact, in the earliest days of COVID, when there was very little impact on children, Children's Hospital came forward and asked how they could help decompress some of the adult hospitals in our state. And that was recognized by our hospital partners just last week in a meeting. And everybody is really coming together here to ensure that we are using all of our beds available. We are looking at transfer processes. We are looking at the availability of EMS resources to move those patients. And we have good partnership in that area. Obviously, we also need to make sure that those who see our kids the most out in society have all of the up-to-date information that they need to prevent the spread of RSV, flu, and COVID. So we are doing a lot of communication with our K through 12 schools, our preschool programs, childhood care, or child care facilities. We're also doing consultations with schools, child care providers, and our local public health partners to make sure that everybody understands what resources are available and the mitigation strategies for all of these respiratory viruses. And then, as always, we are partnering with our healthcare providers to ensure that they have all of the most up-to-date information through our Health Alert Network system. Next slide, please. And so, what is our call to action today? What can Coloradans do to help stem the tide of these respiratory viruses? And as Dr. Herlihy, as Dr. Carney have indicated, the most important thing that we can do is make sure that we get our flu vaccines, we stay up to date on our COVID-19 vaccine, including the Omicron dose. You get your flu and your Omicron dose together. Number two, stay home when we are sick. We know that what can be a mild cold for one person can be very serious for someone else. We are at a point where we once again need to take every symptom incredibly seriously and make the right choice to stay home. And then finally, if your child is experiencing early symptoms of respiratory illness, call your pediatrician, call your family practice, see where the best place to receive treatment is. But as always, if it is an emergency, call 911 or go to the nearest emergency room to ensure that you get the help for you and your family that you need. So with that, Brian, I think I'm turning it back over to you.
Thank you, Director Bookman and Dr. Herlihy and Dr. Carney. We're going to go ahead and open things up for the media Q&A portion of this morning's Media Avail. We're going to use that raise hand function, and I did see we have a couple of questions in the chat. If you want to go ahead and raise your hand, we can make sure that we take those questions as well. You can find that raise hand option along the Zoom console. And let's start with first questions first. Time permitting, we'll come back for some follow-ups or second questions. Please state your name and outlet before asking your question. And anything not answered here, please reach out to me at brian.spencer@state.co.us. Let's go ahead and start with Chris Vanderveen.
Hello, everyone. Thanks for doing this. Thanks for the update. Can everyone hear me, by the way? Good. I wanted to ask a question I think is going to be top of mind for a lot of people. What's the best guess as to why the RSV season this year in particular is starting so early, particularly last year after we had a really non-existent respiratory disease season for a lot of these things, particularly flu? Any idea what's going on, what's causing this?
Yeah, I can take that question. So we know that the pandemic seems to have been really disruptive to transmission of other respiratory viruses. So over the last 2.5 years, we saw probably actions that we were taking during the pandemic suppress transmission of flu and RSV. But we've also seen unusual things for the last 2 seasons, like RSV being transmitted during the summertime and increasing as we moved into the fall. And last year, we also saw influenza being transmitted well into the late spring. So really unusual timing of transmission of these non-COVID viruses that we really don't fully understand. But it's very clear that the pandemic has been disruptive to to how these viruses are spread and when they're spread. But I think lots of work to fully understand what particular factors might be driving those things.
All right, let's go to Meg Wingert. Go ahead, Meg.
Hello, this is Meg Wingeter at the Denver Post. My question is about the efforts to try to use all of the available hospital beds because, it seems like that would still be a smaller number than when you were talking about the transfer center for adult beds. Because, not every facility is going to have what they need for those little tiny airways in a baby. So is there a sense of how much capacity there is that's not being used, or how close we are to the top, so to speak? Thank you.
Thanks, Meg. We are really seeing great cooperation and coordination between the hospitals. And so what we are doing and what they are doing is ensuring that we are decompressing our pediatric facilities the best that they can. And oftentimes decompressing them means not transferring them in the first place. And so we are seeing hospitals that are, would normally only take 18 and over in their adult ICUs. They are decreasing that age down to 15 or 16-year-olds so that those are children that don't need to be transferred to Children's Hospital. Our other facilities are also increasing their own inpatient capacity. They are looking at increasing staff to make sure that they can add beds with those staff. And they are, as Dr. Carney indicated, decreasing some of their, scheduled procedures to make sure that staff is available to provide care to those who need it the most. And our facilities will continue to partner with each other, daily, twice a day, if needed, to ensure that we use every bed possible.
All right, let's go to John Daly. Go ahead, John.
Hi there. Thanks for taking our questions as always. I have a question about masks. I didn't hear in the state's presentation or see in the PowerPoint any mention of masks, although I did hear Dr. Carney talk about that. And I also noticed that in a press release from the state within the last few days. Do you still believe that masks are helpful? Do you still recommend people wear masks? Is that an oversight, or are you stepping back from advocating that folks wear masks?
Yeah, I can start there. So we've learned a lot about masks through the course of the pandemic. Over the last 2.5 years, there have been a number of studies that have come out and shown us how effective masks can be at preventing transmission of COVID-19. And I would include RSV and influenza there as well. We know that masks are an effective strategy, an important way for individuals to decrease their risk of acquiring a respiratory infection, and also can be an important way for individuals to prevent transmission from a virus that they have themselves to another person. So certainly masks continue to be an important strategy. I don't know, Director Bookman, if there's anything you want to add there.
Yeah, I think just to echo what Dr. Hurley said, this is a tool in the toolbox. And our goal here is to provide people with all the information they need to make the right choices for themselves and for their families.
All right, let's go to Kim Posey.
Hi, Kim Posey, Fox 31. Just a quick question about Children's Hospital. And have you had to set up anything outside of the hospital, any sort of like triage situation or check-in like we did during the early days of COVID? And has there been any day when you've had 0 beds available where you've had to send someone who came into the emergency room to another facility?
Thanks for the question. So from a standpoint of triaging, we certainly, like we do every day of the year, we have some nurse triage lines that are open 24/7, and a lot of really well-established, validated protocols where families can call in and really ask for recommendations based on what they're reporting their child is experiencing. As some of you may recall, early in the pandemic, we, as a hospital system, stood up a tent outside of our emergency department on the Anschutz campus. We have done the same thing this year. We put it up about 2 weeks ago and have been using it at times to take care of lower acuity patients who we can safely move out of the emergency department when the emergency department is full, which is happening much more frequently. And so in addition to all of the inside space that we're trying to utilize, just because it's cold and it's much more comfortable to be inside, we do have that space as needed throughout the day and night. To your second question around how are we managing situations when the hospital is effectively full? So like every hospital, we are constantly admitting and discharging patients every hour of the day. And so there are moments where effectively we are coming close to having all of our physical beds full. And in those moments, and as mentioned, one of the strategies that we've been looking at is partnering with our adult hospital systems to send other patients who previously may have been admitted here to their inpatient units. So examples might be straightforward cases of appendicitis or asthma exacerbations, or really other situations where a patient isn't felt to necessarily need pediatric subspecialty expertise at that moment. Our adult hospital colleague partners have really been helpful with this. And we also, in addition to that, as a system, because we have 4 hospitals between Anschutz campus, our North campus, South, and Colorado Springs, we are every day looking at where the biggest needs are and where the patients need to be essentially moved from to help with their emergency department operations. So as a system, we are very frequently having to move patients to other units within our hospitals.
All right, let's go to Bill Folsom. Go ahead, Bill.
Yeah, I was looking for one of the doctors to maybe reiterate the stay home portion. I did an interview last week with somebody who had experienced the RSV and said they had avoided crowds and felt like it was so highly contagious. That's how their kid got it. Kind of 2 parts there, the stay home reiteration, but how contagious is RSV and should parents be aware of that?
So I will be happy to reiterate. I think just like we learned kind of early in the pandemic, one of the best ways to prevent getting infected with viruses is to avoid situations where you may come into contact with people who have flu, RSV, COVID-19. Certainly it doesn't prevent all infections, but at least helps slow the spread of these viruses. And we know that there's lots of situations, whether it be school, workplaces, family events, friends gatherings, where we all want to partake in those, but we would really advise that people think twice before sending yourself or your kids into those situations, because it really is one of the most effective strategies to prevent getting infected. Maybe I'll ask Dr. Herlihy to comment on the infectiousness of RSV itself.
Yeah, so I mean, similar to influenza and COVID, certainly having close contact with an individual is a way that the virus is going to be transmitted from person to person. It's typically going to be through those larger respiratory droplets that don't travel long distances, but certainly being in close proximity to a person who has the respiratory infection is going to be how the virus is transmitted. So as Dr. Carney said, if you are ill, avoiding others is certainly going to be a way for you to protect your family members, other students at school, your coworkers, your community broadly. Can't say enough how important it is for individuals who have respiratory symptoms to stay home. And as we've said a couple of times now, just remembering that a mild infection that you may have could result in a severe infection in a vulnerable individual.
All right, do we have any other first questions in the room? Any other outlets that have not asked a question yet? All right, let's go to Dana Knowles.
Hi, thank you. Dana Knowles from Rocky Mountain PBS. A couple of questions. So I had one kid, I think it was last week, who got COVID, and we're all vaccinated. And then I had a different kid who got sick but did not have COVID. And my question is, like, with the child without COVID, and I'm sure a lot of parents have the same question too, how long do you ride it out before deciding to take your child to the ER or to the doctor? My kids are 12 and 15, so they're not young. And so sometimes I still get a little worried about, well, how long should I wait? How long should, I just sort of pay attention to a cough? And how do we know the difference between RSV and the flu? I guess that's a two-part question.
So thanks so much for the question. So you're describing very perfectly kind of the difficult spot parents find themselves in because there are so many overlapping symptoms with all of these diseases. And I don't expect any parent or even myself to be able to necessarily look at a child and say that's flu versus RSV versus the common cold or COVID. But what I would want to tell any parent is that certainly we don't want them experiencing the stress you're describing of sitting at home wondering, should I go in, should I not go in? Because that is for a tired parent who's been up for multiple nights with their kids, that is a really tough spot to be in. And so that's where these telephone triage lines, I think, come in really handy to call and say, to describe what is happening to your kids. So the professionals on the other end of the line can really either reassure you about what they're hearing or say, you know what you're describing is concerning because I'm hearing, for example, that your child's working harder to breathe, or they've had fever for 3 days and are getting more lethargic or have signs of dehydration. That's really where we don't want any parent to feel like they're on their own and don't have resources. And then certainly, as I tell parents every day in the emergency department, I'm going to be working tonight in the emergency department. I fully expect to tell parents, you are the expert on your child. And if you're worried, we are open 24/7 for a reason and want to do our best to take care of you.
All right. Any other first questions? Otherwise, we can take a couple follow-ups here. All right, let's go back to Meg Wingruder.
Thank you. I wanted to ask, so for children in RSV, since my understanding is that pretty much everybody gets it at some point, usually in their first few years of life, should we be thinking kind of a flatten the curve situation? And also I wanted to clarify, Dr. Carney had talked about avoiding situations where you might be exposed. And did you just mean don't go to these kind of things if you feel sick, or maybe consider putting these things off for now, so from somebody who came to it while they were sick? Thank you.
Dr. Carney, do you want to take that second question and then I can take the first?
Perfect, thanks. So yeah, thanks. To clarify, I think certainly I would advise any family, certainly if they are sick or their kids are sick, to really think twice before bringing their child into situations where they may expose other people, because I think, again, as mentioned several times, we really want to do everything we can to prevent vulnerable infants or people with immunocompromised conditions or otherwise risky medical conditions to get sick. And so please be thoughtful around this. What may be a cold for you may not be the same for the person you come in contact with. I would also reverse that too and say, knowing that there is so much illness out there right now, and because we are trying really hard to prevent people from getting infected and risk getting sick, think twice before going to big events or those close confined spaces where you may be at risk of catching an infection from someone else.
And Meg, to your first question. So when we talk about prevention strategies, we obviously want individuals to be protected, right? So all of the things that we do to prevent other people from being exposed or ourselves from being exposed are really to decrease the number of cases and to decrease the suffering, decrease the hospitalizations and severe outcomes that come with an individual being infected. But as you suggested, we also have a population level perspective here, in that the more infections that we can prevent, the less strain there goes on to be on our healthcare system. And so I think there's both individual reasons for covering your cough and washing your hands, but then there's also population level reasons, again, with the most urgent need, of course, being to preserve our healthcare capacity for kids that need that capacity right now.
Let's go back to Chris Vanderveen.
Dr. Carney, thank you for the candor here. We're kind of using terms we haven't used around here for a number of months in terms of unprecedented and hospital capacity coming back. We're also on the front end of this curve where we're going way up and it's very early. Is the expectation that we're going to peak early, or do we have a few more months of this really steep curve in front of us, which will clearly really challenge hospital capacity?
So I certainly don't want to pretend to be an epidemiologist. I can tell you what I'm hoping for. I'm certainly hoping that we reach the peak very soon. Obviously, that will still put us in still a very tight bind from a hospital capacity standpoint. And we know that we are preparing for weeks to months of capacity challenges in our inpatient units and emergency departments, because even when, and it will, RSV will start going down at some point in the near future, flu is right behind it. And at least in the pediatric settings, flu, for the most part, as Dr. Hurley showed on her graph, does not tend to lead as many hospitalizations as RSV does, but it's certainly a driver of patients coming to clinics and emergency departments because, as we discussed a few moments ago, sometimes those symptoms are indistinguishable from these other illnesses. And so we are mentally preparing for the long haul, and certainly would ask Dr. Hurley if she has any insights on what we think might happen with the RSV curve itself.
Yeah, so, I mean, really, I think all of these respiratory viruses are unpredictable. We know that there's typical patterns that we see, but we also know that the pandemic has thrown things off quite a bit. So I agree with Dr. Carney. We would love to see a peak in RSV soon, but if we look historically at previous seasons, we know that RSV levels do tend to stay high for several weeks. So I think we can expect that RSV levels, even if they peak soon, will continue to be high for several weeks to come. And then, of course, the RSV is not the only virus that we're worrying about. We've got flu and COVID rapidly increasing right now. And I think the most concerning scenario, of course, is seeing peak RSV, COVID, and flu levels all at the same time. And that's obviously what we want our healthcare system to be prepared for and public health to be prepared for. And it's difficult to know how that is going to play out. The last thing I'll say too is that it's not unprecedented for us to see multiple waves of viruses. So we can see one early wave of influenza and then a second wave later in the season. As I mentioned during the presentation, influenza is not one virus. And so we have historically seen two waves of influenza, one caused by one influenza virus and then a second caused by another influenza virus. And so I think the takeaway here is that it's going to be a challenging winter season when it comes to respiratory viruses. And I think that we have weeks, if not months, of challenging transmission ahead of us.
All right, we've got time for one more question. Let's go to John Daly.
Dr. Carney, I'm wondering if you could describe a little bit what the busiest times are looking like at the children's ED in terms of everything from wait time, staffing challenges, moving, having to move patients to different either hospitals or different parts of your hospital. I mean, what is that looking like?
Yeah, thanks for the question. So all of our emergency departments right now are really functioning at a very high clip and are working extremely hard to take care of the patients that are still coming in the doors, but also those who are still sitting in the emergency department waiting for inpatient beds. I will say that the teamwork and collaboration has been amazing while our teams are working through this, but it has been a challenge. We're very fortunate that our hospital, like many others, are really doing everything we can to bring new resources in. So even this week, we are working to bring more help from kind of outside resources in to help with our staffing challenges, because as alluded to, we at Children's, just like every other healthcare system, has not been immune from what has happened in terms of our workforce over the last 2 years. So our teams are working amazingly hard, picking up lots and lots of extra shifts to help care for these kids. But on any given night in our emergency departments, we will have full waiting rooms As you can imagine, if you are a parent yourself who's ever been to an ER waiting room with your kid, it is a place full of a lot of stress and crying sick kids. And our teams, when the rooms are full in the ER, we are bringing team members out to the waiting rooms to round and make sure that we're checking in on families, because those waits, which can extend to hours, each minute feels like an hour for a family waiting in an ER like that. And we recognize that, and we're doing everything we can to, one, make sure that the patients are not forgotten and that we are doing everything we can to care for them, and make sure that we're not missing anything that we need to take care of sooner. So it is stressful, but our teams, I think, are really stepping up to the challenge, and we'll appreciate all the help we can get from our community and all the other partners to really do what we can to ride this out the next few weeks and months.
Great. Thank you, everyone, for joining us this morning. Thank you to Dr. Carney from Children's Hospital Colorado, Dr. Herlihy, and Director Bookman. If there are any questions that we were not able to get to today or any follow-ups you may have, please feel free to email me at brian.spencer@state.co.us. Thanks again for joining us. Hope you have a great rest of your day.